Hey everyone, it's Dr. Kristina here from Bosnar Health, and I'm coming to you today live with Dr. Achina Stein. She's an osteopathic physician and board certified psychiatrist for over 25 years. We actually met through a mutual friend of ours, Rika. Hey Rika, if you're watching. And today we're going to talk about a topic that I am really passionate about, and Dr. Stein, or Dr. Achina, we're going to call you Dr. Achina, okay? Is really passionate about. And, she has experience working with prison population and community mental health and chronic and persistent health issues, geriatric psychiatry. You were really propelled by your son's health crisis in 2010, and she found functional medicine, which helped resolve all of his problems, as well as her own. And since then, you've been practicing functional medicine, much like most of us who enter functional medicine, find that it really transforms our health. And we're like, where has this been? And this can really help my community. Presently, she's practicing in Rhode Island and co-owner of Functional Mind. It's an exciting time for you because you've just launched your online program called Healthy Self Bootcamp. It's to assist people with chronic illnesses to reach their health goals from a distance, which is amazing because that's an amazing opportunity for people to get to work with you from all over the world. You released a book called What If It's Not Depression? And this is the title that really caught me. And I'm so honored to have you here so we can speak a little bit about this book and your passion and how you're really helping change the face of mental health through functional medicine. So maybe you can just tell us, like, what got you into functional medicine?
Well, like you mentioned, my son had a significant mental health crisis. He literally, in 2010, so he was 14. So he was in the midst of puberty, basically. And he had an overnight change in his mood to the point where he was standing on a fifth floor ledge, ready to jump. And he was acutely suicidal, very, very, very depressed, and very anxious. And it was something that was just changed overnight and not expected at all. And, you would think that me being a psychiatrist would have seen some signs of something like that serious happening. And I'm pretty attuned to my kids. And I mean, we were actually traveling in France. We took the kids out of school and homeschooled them while we were traveling in India for 2 months, and then in France for 2 months while my husband was on sabbatical. And, he was missing his friends, which would be expected. And he had a little tiff with his brother, which happens, it wasn't anything unusual. And so, once we got home, I did the typical mom thing, took him to a psychiatrist, had him diagnosed. He was put on medications. He was on an antidepressant, on something for sleep, on something. He also had a lot of difficulty with attending and not being able to read, which was really strange. So he was on stimulants. And although, after a couple months of that treatment, he was no longer acutely suicidal, he was feeling a little bit better, he just wasn't the same. And what made me think that there's something else going on was the fact that he could no longer read. Now, this is a kid who had photographic memory, could read books very, very quickly. He never had an attention problem. And so that was like, there's something else going on. And I couldn't figure out what that was. And along the same lines during that same time, I was actually researching more training because I was sort of at that point with some of my patients, like, I know something's going on here, but I can't put my finger on it. When you do a lot of work with a patient, you get them to a point and they're like, you feel like you're hitting walls. And so I was looking into integrative programs out West, like with Andrew Weil. And so I happened to come upon, just through my searches, a practice called Visions Healthcare. And a physician there by the name of Ed Levitan, who's now owner of 5 Journeys, I asked if I could shadow him, and through his grace, he allowed me to do that. And I happened to think, oh my gosh, this is where I need to bring my son. And so he basically evaluated him, and we made lots of changes, and within months he was significantly better. And by that point I was hooked, totally hooked. And I basically, asked, can I work here? Can I work here? I quit my job. I, went right into functional medicine because it changed my son's life. I mean, he's within months, he had lifelong issues that disappeared, lifelong constipation, lifelong eczema that disappeared within months. And then it took a few more months for the depression to go away. And it took about a year with psychotherapy for the anxiety to go away. And what really, what the clincher was the reason he couldn't read is because he had double vision. And we couldn't figure that out until I was teaching him how to draw. And he was saying, Mom, which line am I supposed to follow? The one on the right or the one on the left? I said, Mark, it's just one line. So it's like, pull over. He had double vision. So he basically had to stop driving and didn't get his license for a couple more years, because that's what took the longest, is that the muscles of his eyes were so inflamed that it caused double vision. And that took like 2 years to go away. I mean, think about it. The cranial nerves are what moves your eyes, right? And so they were really inflamed.
And so, maybe you can just share, because for some people, this is a very, very new concept, that you could actually take someone who is, heavily medicated and make some changes that don't require medication and some psychotherapy and support, and be able to shift them in such a dramatic way.
Right.
That's really the crux of functional medicine, right? Is that we look at diet and lifestyle. And so when we were speaking before, one of the things you had said to me is, like, people don't realize the power of food.
They don't recognize it at all, and he's on no medications. He did great. Once he went to college, when you're in college, you have the stress of studying, and you're up late at night and you eat a lot of junk food. He did slide back a little bit, because you have to maintain those kinds of habits. But he's doing great again. So he hasn't been on any medications, and that doesn't mean to say he hasn't had issues. Everybody does, but it's a matter of learning what to do when those issues occur, and getting right back on track again. So it was amazing that, like I said, within the first 2 months, we put him on a gluten and dairy-free diet, and we had shifted to soy. And what's interesting is that he got better in some ways and worse in others, because then we learned that soy was a major problem for him. Yeah. So then when we took the soy out, that's when things just got significantly better. So you have to sort of figure out what it is for you, what the food sensitivities or allergies are for you. Ultimately, we learned that he had celiac disease, and I don't have celiac disease. I do have non-celiac gluten sensitivity, but my son got a gene from me and a gene from my husband, and his aunt has celiac disease. So, so it's a combination of things that come together, and we never knew that until we actually did the testing. But, he was also one of those picky eaters as a kid, eating just white food all the time. And, at that time, I took them to Burger King and McDonald's, and, we had those parties, the birthday parties every year at McDonald's. And I feel guilty about that, but it is what it is. You learn along the way. But the beauty is that the body's resilient, and it does bounce back. But because of eating foods all those years, pasta, rice, popcorn, corn products, and very few vegetables, very, very few vegetables, got him to be nutritionally depleted, to the point where it affected his connective tissue. I mean, he dislocated his shoulder playing badminton in high school. And when he had surgery, the surgeon said his tissues were like paper thin. And that's as a result of not having proper nutrition. Yeah. It was very nutritionally depleted. And so, but that changed. Once he saw how he improved in the first couple of months, he was completely on board with changing his diet completely. And he's pretty good about following that diet. So, and he feels better. He sees the difference. So, I mean, as he's gotten older, you become more mature about making choices and seeing the consequences. But it's harder when you're a child, it's harder especially the middle child, it's not fair. It's not fair.
So what I hear you saying is that, there's two things, and I see this in my practice often, and most of us functional medicine practitioners do see this. We see either these children or these people who are prone to eating the white food. And when you're little, you have such a little belly that if you fill up on that stuff that doesn't have nutrition, even if you're not so sensitive to it, you're causing inflammation because some of those things might be inflammatory. But the other piece to that is that you're actually nutrient deficient. And so a lot of these behavioral things that I know you and I see in our practices sometimes are just nutrition deficits. And, we both live in North America. I mean, we shouldn't have nutritionally deficient children. And yet we see adults and kids come into our practice all the time with parents who are like, oh, they won't eat anything else but such and such. And one of the struggles, but one of the things I'm hearing you say that I think is, a great takeaway for any parent is that offering nutrient dense food is actually a simple shift. It might not be easy to implement, but adding a blueberry or like a red pepper or a little bit of nutrition so that what's going into our bodies is actually building healthy brain cells. Right. The inflammatory food that we shouldn't be eating, but even just more nutrient dense if we're having a difficult time taking something away, just starting with, giving them the basics of, the nutritions that we need.
Right. I would start with adding things first as opposed to removing, unless, there's really significant issues. Like I recently had a 3-year-old come to my practice with severe constipation. It was mostly because that's all she eats was gluten and dairy. That was it. And so, giving some supplements to try to, get the bowels moving was important first, and to make that change. But to add those phytonutrients, vitamins and minerals, and the rainbow colors of fruits and vegetables are really, really important. And if they are not willing to, take it little bits of it, I tell my parents that small amounts, even teeny tiny amounts, is at least introducing it into the microbiome. And whatever you seed, is what's going to bloom, so like even teeny tiny pieces. So if they roll it in their mouth and spit it out, you're still introducing it, And I think, trying to make shakes or giving, greens in a shake in the beginning, at least to introduce it to the microbiome, will make a big difference and improving that palate. I think what gets in the way sometimes is the texture and tastes of things. Texture more than taste, and that's tough because even the texture of shakes makes it tough, or smoothies, so it is trying different things and keep trying and keep introducing and just being patient about it as much as possible, and educating, setting up systems where where you have time at the table together as family time, and being able to be comfortable in a seat. There's boosters so that the child is able to sit comfortably and not necessarily wander away. We have those patients that graze all the time, right? And being more involved in the processing of foods, in cooking of food as much as possible. Obviously, it's going to vary based on age, but getting them more involved and interested in food and having it out on the table.
Yeah, I know.
having it always there, you
I know
know?
recommendations that someone gave me when my kids were little, and I have three as well, and they're great eaters, was put all the stuff you want them to eat, the nutrient dense stuff, the vegetables, the fruit, the protein, on the table first, and the non-nutrient dense stuff like the pasta, the white potato, don't make it yet. Make it eventually, because when they're hungry, they're hungry. And you know,
Right.
the pickiness, I mean, this is a different conversation. It could be a whole conversation.
Right. Right.
But we are mammals and we do eat. And sometimes for those kids who have a problem processing the dairy and the gluten, because it turns into a morphine-like substance and really stimulates those
Right.
pleasure centers, you might get a little kickback, and you know, you might get a little angry child. And it's really our place, which is the difficult place as a parent, to hold the space
Right.
and be like, it's okay that you're angry. It's okay. You will
Right.
be hungry. Here's a little
Right.
piece of something. Mommy's going to eat this. What do you think of this? And it's, you're, like you said, playing with it. We have a vegetable garden. I live in the middle of a big city. We have an
Right.
organic vegetable garden. My kids will pull out, they grow it, they pick it, they eat it. And it's another way to introduce them to it. So there
Right.
are lots of ways, right?
Right. Yeah. And you mentioned something very important is the glutamorphin and the casomorphine, that if the gluten foods and the foods with casein protein, that's the dairy protein, are not digested appropriately, that it's going to create peptides that bind to the new receptor and cause almost like an addiction of sorts. And so improving digestion is going to make a difference in your mental health. So, and it's also trying to figure out, well, why is this person not digesting? You know, and if you're eating at all different times of the day, you know, the gut really likes to have rhythms. And so if you're grazing throughout the day, then your body's not going to know when to release the acid and the pancreatic enzymes and the bile salts in order to digest those foods. Yeah, another aspect is stress. Stress can absolutely disrupt digestion. So, you know, if a child is not feeling safe, then their stomach's going to be in their throat, you know, they're always living in fear. So, or is unable to settle down and just relax, you know, and be connected to food and smelling the food and chewing the food. Chewing the food is so important. So a lot of times kids are sitting at the table and vacuuming it down. But, you know, really, you know, I think it's the take home that I would love for parents to understand is that, you know, you can make a big difference just by changing the diet and changing habits. You're going to notice a difference in a child with changing those things much faster than any medication will, because it does take 6 to 8 weeks for a medication to work. And a lot of times kids end up having side effects from those medications. It's actually a much faster and safer intervention to change the diet and address the sleep. And there are many supplements that are safe for children that can help and support in those areas. Ultimately, food is medicine, but supplements help to bridge that and make things happen faster. But yeah, I've had a number of children who have gotten better just by just really doing the 5R gut restoration approach of removing inflammation, what's causing inflammation. So that's foods, infections, toxin, stress, replacing what's missing, and that's vitamins and minerals and phytonutrients, re-inoculating the gut microbiome and repairing the gut lining, and then rebalancing whatever caused that disruption. And so figuring out, well, where did things go wrong and how can we sort of go backwards, you know, work backwards to figure out what happened.
Yeah, oh, for sure. So then why did you write this book? What kind of made you, but now doing this, you've obviously had your own personal experience, which really transformed you as a physician, which luckily for us, you know, then you wrote this book. Why did you decide to write it?
Well, you know, people find me through Google searches and through the Institute for Functional Medicine website. And, you know, there are so many people who are frustrated with the current medical system, that they spend 2 to 5 years struggling and trying to find answers. And I wanted to sort of speed that up for people by putting a book out there so that they don't have to search for so long. And it occurred to me that, I mean, I have patients that finally start working with me. And like I said, within 3 to 5 months, they feel so much better because we've gotten to the root causes. And so many times people have said, oh, I just wish I found you first, So it's sort of, my book is sort of a way to bring awareness to what's possible for those people who are taking medication and are not getting better from it, or have gotten partially better, or are having side effects, or a combination of those things. And obviously psychotherapy is also very, very important. There's other methods of treating depression like ECT and TMS, but if you're not getting better, and medication is a choice that some people can have, and I if that works for you, great. I'm glad that it works for you. But there are a lot of people where it doesn't work for it. There's also people who just don't want to take medication. They want to figure out what the root cause is, and they're not satisfied with, here's a prescription, just take the pill. They don't want that. And so there are so many people who prefer the approach of getting to, well, what went wrong and why am I feeling this way? But what a lot of people don't realize is that you can feel this way for a really for years and years and years. I had a patient who came to me for panic attacks, and that was the purpose of him seeing me, was to resolve the panic attacks. And, as I got to get to know him, he had told me about a lifelong history of a low level of depression. And he kind of thought that was just like his personality. Grew up with, single mom and distant kind of from her, but she was, she provided for him, but not on an emotional level. And he just thought, well, this is just who I am. And, after 4th or 5th visit, I mean, his panic attacks were gone, and he made all these changes, and that cleared up pretty quickly. But then he started saying something about, wow, I'm feeling different in terms of my mood. And he described what he was experiencing. I said, like, is this joy? Am I experiencing joy? So he didn't even expect that to go away. Didn't expect it at all. And
when I think that we're seeing a large increase, I've been in practice for over 2 decades, and we're seeing a large increase in mental health issues in our youth. So it's possible to just think that this is how you're always going to feel. I'm an anxious person, and I've been told I was anxious because that's what my parents think, and I haven't been diagnosed, I have anxiety, or I'm depressed. And, the idea that making simple changes like you're talking about could have any impact on something that I've had my whole life since I was a kid seems like such a foreign concept. And yet, as you and I both have seen in our practices, it's so transformational and
it is.
possible.
It is. Yeah, absolutely. Yeah, I mean, you said multiple things, and I was like, my mind is going in 5 different directions as to how to respond and which one to respond to. So, yeah, I mean, you said something, it's simple. They're simple, but they're not easy to do. I mean, you have to, it is hard, especially for teenagers, because of the age, they want to do what their friends are doing. They want to eat what their friends are eating, and they feel left out, or they are embarrassed. So like, I can't eat that. I can't go there. I mean, even adults go through that too, about like, okay, what to eat at, in a restaurant. I mean, these are all, it all makes people uncomfortable. But I think when you are feeling as bad as you are, it is a conscious decision to make that, okay, I'm miserable. These medications aren't working. I've tried all these other routes, and you basically are at a dead end. The only thing you can do is turn around and go towards functional medicine. But I want to encourage people who are in that place to do that, I mean, and literally, I mean, the average person who I see takes about 3 to 6 months to get their life back. It's 3 to 6 months of work. It's work to make these changes. And so but it is definitely doable. And most of my patients have. There are certain certain areas where people get tripped up, and those areas would be if you have like a chronic infection like Lyme's disease and co-infections, or if there's mold involved, if you have heavy metals involved, if you have an autoimmune illness. There are certain things, as you know, that might extend that longer than beyond the 6 months that I see. But if you're already relatively healthy and those kinds of things aren't happening as much, then I think that it's a doable thing, and I see dramatic changes in mood. Dramatic.
Yeah, and I mean, it's so inspiring too, as a physician, but also for people hearing this, that there might be a way to change, their future, or their child's future for that matter. So if someone was coming in and they've had their first assessment with you, what's one of the first things that you like to do, or one of the first steps in your treatment that you would do with a patient?
Well, before I even see a patient, our intake is 39 pages or 49 pages. I can't remember now. It's pretty long. So, I mean, the most important thing is to gather as much history as possible to figure out, and it's that history. It's like if you like doing jigsaw puzzles, each piece of that history is a puzzle piece of who that person is. And as you put those pieces together, the picture kind of comes to me in terms of, okay, this is what went wrong, and this is what we need to do to fix it. So getting that history up front, even before I see them, I put all that history in a timeline to look at all the different layers and drivers of what caused inflammation in the body. So the goal is to remove inflammation and to find what is causing that inflammation, and then the treatment is directed based on that. So it's going to be different from one individual to the next, but for the most part, the first thing I would do is put them on a diet that's appropriate for them. It typically is a paleo diet, gluten-free, sugar-free, gluten, dairy, and sugar-free initially, and for at least 30 days. It has to be a minimum of 21 days, but I say 30 days because that's just when my next follow-up appointment is. And then we do some testing. And so I like to see what's going on in the gut. I like to do a stool test, and I do an organic acid test as well, to see what's happening in terms of some certain types of bacteria, like Clostridia. Clostridia significantly can affect the brain in terms of dopamine and norepinephrine production, and that can in turn affect serotonin production. But there's also, it's a nice yeast markers. It gives a nice idea of what yeast and other fungal markers are playing a part. Fungal markers can significantly affect the brain as well. So those are the two top tests that I do, aside from some blood work right from the get-go. And I address stress and movement and sleep. So these are all areas that if they're that I review to see where the person is in terms of those areas, and go from there, basically.
Sounds very similar to our approach as well. And I just think getting a baseline of what's going on the inside and not guessing. Most of us in functional medicine want to test, so we're not guessing what's going on underneath. And so tell me what SHIFT is.
Oh, SHIFT is an acronym that I use. I'm sorry?
What is shifting physiology?
So what we are trying to do to affect the change in the body is to shift your physiology. And the way the areas that we look for root causes is stress. So SHIFT is stress, hormones, infections, foods, and toxins. And so those are the areas that we look at in terms of what we want to remove and or replace in terms of directing or bringing down inflammation in the body.
And so which part do you find people have the most hard time addressing when it comes to those factors? You already talked a little bit about infections.
Right. So stress, I think, a lot of people don't really have a sense of how much stress they're under, unless it's like, their head blowing up, people put a lot of pressure on themselves and they kind of live there, you know what I mean? And they have no sense of what not being there is like, and don't have a sense of always driving. It's almost like, you know how like there's some people, I'm one of them, who drives always at 80 miles an hour.
Yes.
You know, like there's no in between. It's always 80 miles an hour. They just get into the car down the highway, 80 miles an hour. So, and just even shifting down to 55 feels really strange. Right? Really. So it's almost like people don't know what it feels to, you know, shift into a lower gear and be there for a while. It makes them uncomfortable. Right. And sometimes people are in overdrive or driving at 80 miles per hour, I mean, as an analogy, because if they slow down, something might creep in to their mind that's uncomfortable. And that typically, my experience is that's typically trauma, things that you're trying to avoid noticing. And so if you've had early childhood trauma, and you may have done a lot of work to move beyond it, but some of that work could be also having habits in place to avoid and therefore suppress those feelings. And so in order to keep avoiding and suppressing, you have to sort of keep running away from those feelings. So part of addressing stress is to bring those feelings, you know, bring that level down, and then notice what's happening in your body that's causing those uncomfortable feelings. And then if you actually process those emotions and put them to bed where they really belong, which is the past, then, you know, then you can calm down and not feel like you have to move, you have to run, you have to keep going, right? Yeah. So some people don't realize that they're in overdrive. And the thing about how to do that's work, you know, it's work that's done in a therapist's office, but you don't have to see a therapist in order to do that work. There's online programs, like Tara Brach has a wonderful online program going on right now, actually, to help you work through those kinds of feelings. And so having habits in place of stress reduction on a daily basis is really, really important. Having a practice that you don't just put on the back burner. You have to have it on the front burner. You know, you have to have it always there, always addressing on a regular basis, because it takes time to develop those habits in practice. And if people are under a high level of stress, it makes it almost impossible to do all the other things that you need to do. Because as we talked about with digestion, if you're always in fight flight, you're not going to be able to digest your food, because you have to be in parasympathetic mode in order to rest and digest and heal, right?
Well, and one of the things that you mentioned, you know, about stress and people having a lot of stress, which is ubiquitous. I mean, I have stopped listening to people and stopped counseling my patients years ago to decrease their stress. And one of the things that you're mentioning about, because if you live in a busy city and you're a busy parent or a busy exec or a child that, you know, has busy parents who are running, there is the stress. And I think what we've noticed maybe in the last 10 or 15 years, because of poor diet, because of lack of outdoor play, because of lack of exposure to sun, because of, you know, poor sleep, I think we've started to see less resilience, less stress resilience. And by doing the things that you're talking about, you know, reducing inflammation in the body is physiologically better able to deal with the stressors that come, because they are going to come.
Right. Right.
And that's maybe why the easiest step is trying to build that nutrient density, that body's resilience to stress, so that we can do the hard work, be it, you know, us as adults or our children, which, you know, it's hard for us to watch them do their work when they're struggling. I'm sure it was difficult for you to watch your son struggle.
Right.
And I bet. Go ahead.
Yeah. Yeah. Sometimes you have to let them struggle. I agree. Yeah. They have to find their way. And I think sometimes we as parents don't allow them. We want to fix it right away. We want to do it for them because you don't want to see them in distress. But sometimes you have to have some distress, some level of distress to work through it. But it's also learning how to be uncomfortable. It's okay to be uncomfortable because you can't grow without being uncomfortable. Growth doesn't happen unless you're out of your comfort zone. And so I think as parents, we need to help our children understand that it's okay to feel the way you're feeling. Just keep, be patient with yourself, keep trying, keep working at it. You'll be all right. And just encourage them and support them and be there for them, but don't do it for them. Don't tell them how to do it. Let them work it out and show confidence in their ability to work through it. And because if you sometimes I see some parents take over, and then that actually kind of deflates a child's confidence. Oh, you didn't believe in me that I could do it. That's why you took over, right? And so, yeah, sometimes, every child's different. Obviously, some children might think that, other children might be, okay, go ahead, take it over. I don't want to do it. Right? So
I think what we've lost as parents, and I know I have 3 of them. My oldest is now almost 12, but I know with him when he was little, I didn't want him to be upset. And we've lost this ability to tolerate their big feelings. And my first child has very big feelings. He has big feelings. He's right. A deep soul, but his feelings are big. So when they're happy, they're great. And when they're, angry or negative, they're big and they're scary to him. And I think that what I've noticed made the biggest difference is showing him that I can tolerate him being angry. I can tolerate him being upset, and that he should be able to tolerate. And I think that is the other piece that's hard as a parent, is that you're so scared of your child being sad or scared of your child being angry, not just at you, but having those negative feelings.
Right.
We want to wipe them away. And we do that sometimes with food, with like, oh, it's going to be fine. It's going to be fine. Instead of like, what I have found has worked, and I'm sure that this is what you're alluding to, is like, if we can tolerate their feelings and we allow them to learn to tolerate their feelings, they're going to be more successful in being able to get over their feelings or learn from their feelings and make the changes.
Right. Well, you can't learn how to modulate your feelings unless you allow the pendulum to swing. Right? How can you, modulate a pendulum swing if you don't allow it to swing at all? Right? So, it does take a safe space provided by parents to allow for a child to have feelings and not pathologize it. And unfortunately, our culture and the media, is very quick to call feelings depression and anxiety. My biggest pet peeve is using words like, my OCD got in the way, or my ADD got, like, people are self-diagnosing all the time. And, these feelings are on a continuum, and it doesn't become a disorder unless it causes severe occupational and social functioning, and so it's the word disorder. The other big peeve I have is calling these disorders, these mental disorders, is diseases, because they're not diseases. They are a cluster of symptoms that we've given a name to, and so that we can identify what it is a person is experiencing. It tells you nothing at all about what's causing it. And that's where discussion occurs. But these disorders were named purely for, conveying information from one researcher to another, one practitioner to another, but it says nothing about what is causing these symptoms. So I think really it's important to not pathologize feelings and to find appropriate words as to what's actually happening. Like, I'm disgusted, or I'm frustrated, or I'm sad, or I'm moody, or, there's all sorts of words. And in my book, I have a whole list of words that you can use to try to describe what's actually happening, as opposed to jumping to some kind of disorder of sorts. It doesn't have to be that. And there are other ways to handle these issues.
Well, and when we have a name, then maybe we can fix it, instead of really understanding, and myself being included in this group, that there are negative feelings and you got to work through them, and it's part of being a human being and having relationships and letting yourself down and then working up again. So tell me, there's words like integrative and functional thrown around, and for those people who have never heard of functional psychiatry, how is it different than integrative psychiatry?
Well, if you look in the textbooks, the integrative medicine textbook, I think it was Rakel, that's the author that's on my shelf, where he calls functional medicine a form of integrative medicine. But integrative is, most people understand integrative as using multiple modalities to affect a change. I think functional medicine still does that, where you might use massage or acupuncture or sauna, all these other modalities of treatment to effect a change. The biggest difference, I think, that separates functional medicine from integrative medicine is that we really look for the root cause of the problem, and we tend to focus on inflammation and starting with the gut. That's my belief as to what functional medicine is that the place to start would be to shift physiology at the gut level, because that is where 80% of your immune system is. And if you can lower inflammation in that realm, a lot of other things it's sort of like plugging the dam or fixing the dam, so that you're not having this spillover, of all of the causes of inflammation. So I lost my train of thought.
What I hear you saying is that, starting with the gut is important. And you spoke about the food piece in, healing the gut so we can absorb the food, healing the digestion so we can, again, make our neurotransmitters, have the building blocks to make the brain chemicals that we need, to run the biochemistry of life. And so I had a question come to me before, and you're the perfect person to ask it. If a person comes to you because they really want to stop their medication, either it's not working or they just don't like the idea and they know there's a better way, like, how do you decide how to do that, or if you're going to do it or not?
Ooh, there's a long answer to that, and I'll try my best so, history is going to inform me a lot more in terms of whether or not to continue medication on a long-term basis. So anyone who starts with me, I do not make any medication changes except to make them more comfortable if that's possible. So if people are on medication and they're somewhat stable but not quite, I might tweak the medications to get them stable, because the work of functional medicine does take time. You have to be you want to be chronically stable. You want to be stable in order to do the work, because it's going to take a few months to learn what needs to be changed and really do the work. And if you can't function, you're not going to be able to do the work. So I make sure that a person is not having side effects of the medication. If they are, then I'm going to make a change and get them to a place of stability. And I might advise to continue some medications long term if they've had a history of multiple suicide attempts, if they've had a history of multiple inpatient hospitalizations, or ECT. That doesn't mean to say that down the line, maybe 3 years from now or 4 years from now, that might change. It depends on what's changed in their body, and that only time will tell. It's not going to be, I don't have a crystal ball. I have had patients who have had that history and have come off medications or most of their medication. So it's really figuring out what the root causes are. I think if they're coming from a place where they eat a lot of processed foods, to me, like, that's like heaven. It's like, oh, this is going to be easy. If they're already eating really healthy food and they're exercising, and you know what I'm saying, and they're not, and they're, then that's like, okay, we got to dig deeper, right? But I will usually continue the medications until we've gone through that gut clearing, healing protocol first. And then based on how symptoms have changed, I'll make changes in the medications. Now, some medications I can probably taper pretty quickly. Sometimes, and the other reason why I don't make any medication changes is because if they start having withdrawal symptoms, I'm not going to know, is it because of the work we're doing or is it because of the medication change? So it's the other reason to keep the medications changed the same, is to just not have another variable at play, if that makes sense. So, yeah, I have been able to get many people off of medications, and then there's others who for a variety of reasons, like I have 2 patients who have had pretty severe concussions, traumatic brain injuries, and it's just that they are probably going to need to be on medication long term. Maybe with some more work, I'm still working with them. We might be able to effect a change, but it is those conditions like small intestinal bacterial overgrowth or mold or Lyme, co-infection. It's those kinds of conditions that kind of keep a person on medication longer. That doesn't mean that it's not. They may never come off of them, but those conditions have to be managed and handled first before making a change, because what your brain needs is basically through the gut microbiome, essentially, and so yeah. And as you probably know, a traumatic brain injury kind of shocks the vagus nerve and disrupts the whole enteric nervous system, and there's the gut-brain connection, so all of those things need to be managed on at some level. So, but it's doable. It's just sometimes it does take longer for some patients than others.
Yeah, but what I'm hearing you say is that, and I would say this to a person who's considering it or who's been on medications, not happy, not doing well, or just wants to do better.
Right.
Doing all these things that functional medicine does, changing the diet, increasing nutrient density, decreasing infections that you may not know you have, which is so common. I think that's kind of the crux of most of our functional medicine initially. We see this digestive dysfunction, that people can, move forward in their healing journey, which is really what it is. For some faster and some shorter, but
So the other thing is that some people who want to stop medications, they might have that desire, but there's something in the back of their mind that is not sure. There's like, well, maybe that's not a good idea, or they don't have the confidence that they'll be able to be okay without medication, because you have in your other ear, the American Psychiatric Association, all these medical, their therapist or their primary care physician saying, no, stay on the medication. So there's always going to be some doubt. So I would rather prove to them that they're better with the medications the same, and that they get better with all the interventions that they've done with me. And then they have the confidence, like, okay, we didn't change the medication at all, and I got better despite it, even though I was on that medication for a year or 2 years, and we didn't change that, but we changed all this. Clearly it's not the medication. Yeah. So then it gives them the confidence to come off the medication, to see how that works, because you can actually, create symptoms based on your fear of relapse, right? Yeah. And so then, if there are going to be some people who have withdrawal, and that's tough for some people. There's some people who have really severe withdrawal. I had one patient who we were able to get down to 5 milligrams of Paxil, and Paxil can cause severe withdrawal. It's really tough to get people off it. And I had to compound that medication, and it took a year of 5 milligrams for 2 months and 4 milligrams for 2 months, and 3 milligrams for 2 months, then 2 milligrams for 3 months, then 1 milligram for 3 months. So as you go lower, you have to go slower and slower. So, but when you're already feeling well and it's not the medication that got you well, then it's so much easier to come off of it. Because, once I'm off this medication, and because the way I'm feeling is due to withdrawal, not because I'm I'm having depression or anxiety, it's withdrawal, it's not a good feeling, then they're able to tolerate that transition and come off of it, and then they feel great.
Yeah,
so
that's incredible. I mean, so hopefully that's a lot of information that a lot of people don't know, and opening our minds that there is, out of all the possibilities out there, that are some possibilities that can move you forward. And I think that's why I'm so grateful you wanted to come and speak here and share your experience and share your book. So what's your ideal scenario for how mental health should really be approached in 10 years from now? Knowing what we know now that we maybe didn't know. We didn't know about the gut-brain connection 10 or 12 years ago. And we know so much more now, and we are going to know more. How would you love to see it being treated, in 10 years from now, in your ideal world?
Well, I mean, I think ideally, we need to address the way our food system is, right? We have to change our culture around food, and really, we need to change how we serve lunch in school. We need to change our education in terms of food is medicine. And ideally, I think the first intervention should be, if there is a mood change, obviously you want to make sure a person is safe, right? Before, you wouldn't, if someone was suicidal, you wouldn't just say, okay, here's some vitamins and and a diet. Obviously that wouldn't be the answer. You want to make sure that they're safe and get them stable, and in terms of if that requires medication, then so be it. But as long as they're safe and stable, and but having distress that's making them uncomfortable, you want to figure out, well, what's going on and why. And that might be looking at the biology or the psychology or socially what's happening in the home, if it's a child, or is there domestic violence. Like, there needs to be a more comprehensive approach towards the problem, rather than a 10-minute session, a visit with your doctor and handed a prescription. And so if it is a stable situation where the person is safe, then the first intervention really should be your diet, to look at the diet and look at your lifestyle. Making dietary and lifestyle changes actually can work faster, depending on what else is going on, but for the most part can work faster than what an antidepressant can do. And I think antidepressants should really be reserved for serious, dire situations. I'm not anti-medicine. I just prefer to use it in situations, and I still prescribe medications. I just don't prescribe them as much. But they should be used in situations where these other things aren't working, or you're having chronic issues that take time to implement interventions, like I've mentioned before. So I would like to see that medication isn't the first answer. And obviously psychotherapy. Psychotherapy is a very, very important part of treatment. And if there's trauma involved, then psychotherapy is going to be a long part, ongoing part, of treatment. And it is learning how to distinguish those things. So having people trained to be able to determine which interventions would be appropriate and at what time. And sometimes there's layers of them at the same time. But that's based on what the individual wants to do and needs. So it's always a conversation, as you probably know, But it would be nice to have more of us doing these things.
I love the idea of having the conversation about how do we start feeding our brains at the school level? How do we teach parents what a nourishing meal looks like? Because I think that is where we have to go, because we do have the sickest generation of kids that's ever been seen.
I know.
In the last 20 years, from the start of practice till now, it's a huge shift. And so if we can get right to the root, and I think that one of the root causes is just poor nutrition, lack of nutrients and inflammation through food. I think it's such a great, it requires work in the school systems, but I think that that's something that parents should really look into, that we should talk to our school systems about this, because it is going to save us from this, having this generation of kids who have their brains on fire. I mean, outside of the parenting and everything else, just that base level that we should be getting. So I thank you. How can people find more about you, about your course? How can people read a little bit more?
Well, they can find me at my practice website, Functional Mind. It's www.fxnmind.com. People are able to get my book from Amazon Kindle as a Kindle version. The print version will be coming out later this year because it was picked up by a publisher, Lifestyle Entrepreneur, and that won't be until May of 2021. Unfortunately, it just takes that long. But an audio tape version will be available in October. But so you can get it for $7.99 on Amazon, and there's lots of links within the book that makes it interactive. There's lots of quizzes in there. It's very user-friendly. You could also go to www.achinasteindo.com to get a free PDF of my book. And I'm in the process of putting a program together that is a companion guide to the book, and that will be coming out probably in about 2 months.
Amazing. So for those people who just want to get started, and maybe in their town or in their city, they don't have anyone that's functionally minded, this way they can reach out. Like you said, you have this online program, but the book is a great place to start. I thank you again for coming. It's such an important topic. I think especially now, but anytime, it's important for us to really try and, dive deeper into the underlying, root causes of why we're feeling the way we're feeling, and how we can maybe, take control a little bit about how we're feeling to move forward. So I thank you so much for coming, Achina.
Thank you so much for having me. It was so much fun.